I'm Parul Kakad, Mumbai Mummy, mother of 4. Like everyone going through everything during this pandemic, I've also fallen prey to COVID with my kids and myself. And today I'm here with my pediatrician, Dr. Nihar Parekh, who helped me through this in a really good way. And thinking about it, I came across a lot of moms having a lot of questions, asking me questions, and thought that maybe I can club together a lot of questions and answer everything and have Dr. Nihar answer them for you today. So, hi doctor.
Hi Parul, how are you? How are the kids?
Good. Shall we start?
Yeah.
Okay, doc. So, how are children getting affected by it?
So it's a very different situation, Parul, this time in the second wave. The first wave was always about, we hearing about children being carriers. We don't know, they may not manifest, but still they will have the potential to infect others. But this time, because the double mutant strain, that is the B1617, which has been predominantly there in our country over the last 3 months, it is starting to affect children as well. Affect children, infect children. They're no longer asymptomatic carriers. They're actually going through the disease for a few days. This mutant virus is also affecting adults much more. We have younger people in critical care, in ICUs, requiring oxygen. We have slightly more deaths, but it definitely impacted children. Now, the children are manifesting as a full florid COVID disease, but the severity of it, the intensity of it is much different. But yes, we are in the midst of a COVID storm, even amongst children, but a storm that we can easily manage and easily handle.
Okay, so do you see symptoms more in older children versus younger children, or is it just the same for all the kids?
So it's a range. We see kids from, 1 year of age to around 15 to 16 who I feel have the bug. Now, I'll put it the other way. Today, out of all the patients I see which range from 1 year or newborns to 15 years of age, if any of them were to come in today with fever, I would tell the parent to take it as COVID unless until proven otherwise.
Right.
That's rampant. The belief that the COVID does not enter the house, I have not left the house, so I should not get it, my child should not get it, is a myth now. COVID has entered every home. COVID is there in your house or can get into your house, irrespective whether you left the house or not left the house. So I need mentally people prepared, parents prepared to fasten their seatbelts, buckle up, take extra precautions, but we're going to get through this. Children are getting affected, but they are responding very well to regular treatment. So we are seeing a lot of kids. I think the youngest patient I may have predicted or I may have seen maybe up to 9 months to a year of age, going up to 15, 18 till we see. So they're pretty much adults, a wide range of ages.
Okay, and from a scale of 1 to 10, how many kids are seriously getting affected?
So if you talk about the severity of the disease, on the scale of 1 to 10, 10 being the most severe, requiring intensive care, I think I'm very happy to announce that in the last 2 months, we've seen none.
None? That's good.
When it comes to severity of symptoms, we've seen kids ranging from severity of 2 to 3 to up to 5 to 6, where the worst of them, the fever lasts for more than 5 days. We get a CRP going up, blood counts and platelets going down, D-dimer going up, requiring as much as a drip, maybe at a hospital for a few hours a day, and they snap right out of it in 3 to 5 days.
That's great. So parents shouldn't get into a panic with...
No, I'm going to use this opportunity to tell every parent not to worry about their children getting COVID. Even if they do, it's very manageable. Your pediatricians so far have it under control. There are no really sick kids. The dreaded complication of MISC, which people have heard about, which is something we were very afraid that may pick up in intensity and numbers over time. Okay. But over the last 2 to 3 months, it's not picked up at all. Okay. So I'm very happy that MISC as of now for us is that really dreaded disease, but it's still fictitious for us. I'm not disregarding the fact that MISC doesn't exist, and I want every parent to keep that MISC in mind, with one note that post-COVID recovery, by the second or third week, your child is doing fine. But overnight, if you see a sudden deterioration in your child's health in the form of sudden onset high fever again, loss of consciousness, decreased consciousness, drowsy, sudden onset vomiting, sudden onset loose motions, unbearable body ache, and you know your child is terribly sick overnight, that sudden onset of symptom is when the red flag for MISC will go up. Because that's when you need to pick up the phone, talk to your doctor, that look, this has happened just in the last 6 hours. He or she will know what to do. They are prepared to handle it. Luckily, we've not been put through it as of now.
Okay.
And we are managing to handle kids just with oral meds or few days of drips. So very glad for that.
Okay. And how soon after they recover from COVID does MIC happen? How soon?
MISC, if it happens, it's known to happen in the 3rd or 4th week post-recovery.
Okay.
And I want to re-emphasize on the word sudden deterioration of health.
Okay, sudden.
Just keep that timeline of 3 weeks. Every parent will panic for that 3rd week.
Okay.
Don't do that.
Okay.
With a slightest rash or a cough in that 3rd week, the parent will put it together and connect it with MISC and press the panic button. I don't want them to do that. Just look at the general condition of your child. You as a mother knows that look, my child is well or unwell. Even the slightest of the things you're able to pick up, this will be super evident. This will be a sudden crash. So you will be very aware that something's going on. That's the time you need to pick up the phone, even if it's in the middle of the night, talk to your pediatrician.
Okay. And what are the first few signs or symptoms in children, and are there any new symptoms showing up as the days pass by?
I'm very happy to again say that there is nothing new developing. I would say 80 to 90% of the kids, it is still high fever, which they present with body ache and headache. We have to remember it's a pan-systemic virus. It infects and affects every system of the child's body, starting with the headache, earache, red eyes, throat ache, difficulty in swallowing, cough, cold, shivers, body aches, severe body aches, leg aches, cramps in the stomach, loose motion, So pick a system head to toe. It involves almost everything. But the constitutional symptom that we think of, or the bell goes on our head that this can be COVID, is A, high-grade fever for more than 1 or 2 days. And on clinical examination, when they come to us after 2 days of fever, we can make out just looking at the throat, maybe the throat of the child, just looking at putting a hand on the tummy, and we know that, look, there's a high possibility of COVID. So everybody mask up.
Okay. Also, should we get COVID tests done for kids?
So by law and by rule, I think today there is a high need of parents to know whether the child has COVID or not. But we also have to understand that there is a simpler way to it. If every child through COVID, what happens is we usually tend to wait for the report to come and then put on your mask and put on your protective gear or socially isolate or even go to the doctor. But I want to tell every parent that today, as of now, in the current scenario, even if your child feels the slightest of warmth, even if your child records 1 day of 100 fever, even if your child comes and says, Mom, I'm not feeling good, I'm feeling warm and I have a severe body ache, the first thing that every parent should do is mask up. Now, it doesn't sound like being a pediatrician, but I am this time as a pediatrician not worried about your children. I am worried about what that sick child can do to the adults. I am worried about what that sick child can do to the grandparents, and in today's day and age, even that 35, 45-year-old mom and dad who can end up in the ICU, even for the 10 minutes or 15 minutes of initial fever that you just wanted to hug your child and make him or her feel better. Do it. I'm not saying no, but please, for heaven's sake, put on an N95 at home. Those days of double masks, those days of cloth fancy masks with these gold chains hanging, those days of a surgical mask are actually gone now. Everyone with a sick child at home needs to mask up with an N95. Even if it's a 99, even if it's a 100.5, even if it's a 1-year-old, even if it's a 15-year-old.
Okay. And doctor, as normal parent instinct, when our child falls sick, and we are also sometimes, we might just have the symptoms, we directly tend to attend to the children. I've also been trying to tell a lot of people that, like you said, mask up, and they get all the tests and everything done. It's equally, I want you to tell people that it is equally important to look after your own health while the child is sick as well. Because a lot of times the parents completely ignore their symptoms and only focus on what's happening to the kids.
Correct. So it's a very standard protocol, Parul. Remember what happens when you're taking a flight and there's a sudden dip in oxygen, or when they're training you how to use the oxygen mask. What is the first thing they say if you're traveling with a child?
Your own mask.
Put your mask on first and then the child's.
Right.
So do the same at home. Again, I'm making it very clear that your pediatrician will be able to manage your child very well. Your child will be okay in 3 to 5 days. But those 10 to 15 minutes of motherly love taking over you and you trying to take care of your child without your mask on, it will put your life in peril in today's day and age. Because with the new mutation strains, we've seen 35-year-olds, 40-year-olds reaching hospitals and ICUs. I'm not even talking about a grandparent. They should not be even in the same room or even the same apartment if possible, if there is a sick child in the house. So I want really everybody to mask up. It's up to an individual parent to test their child or no. But the load on the Indian and the Mumbai labs right now, getting someone home for a COVID test takes time. Getting the report in 3 to 4 days takes time. I don't have an issue if you do the test, but do not wait to mask up for the results. Do not wait to isolate for the results. Do it the minute your child shows the first symptom of fever.
Okay. And some RT PCR reports are testing negative, but patients and kids and parents are both getting all the symptoms.
Yes. So I would take it as, like I said, in a current condition of the scenario of today's pandemic, plus the area we live in, where there are high and super high number of cases every day, when your child gets fever, take it as COVID. And then what you need to do, just take it as COVID. What does it cost you? Masking up for 10 days. How does that change your anything different from what you're doing right now? So all I'm asking is mask up immediately. Because even when you test, there are 3 reasons you may get something called a false negative. Means you have the disease, but the report comes negative. Number 1 is how the swab was taken. So the technical error. The swab needs to actually go right behind to the posterior wall of your throat, which is called the nasopharynx, which is an extremely uncomfortable feeling to have. The child, when a person comes in to test, may not have the guts or may not feel that good to shove it right in the child's nose, or the child may not allow that the person to put it that deep inside. It has to take 3 turns, collect enough secretion, put it back again. It has to be stored in the right temperature, processed in the right amount of time, and done at the right time of the sickness. RT PCRs done later in the day with slightly reduced viral loads, where the viruses have already gone down, may give you a false negative.
Okay.
The sheer load that every lab is under, the clerical errors are high, the logistical errors are high. So the clinical diagnosis now, considering the masks and the numbers at which COVIDs are coming positive, I would say do not depend on the test. If the child has fever, take it as COVID unless until otherwise. If the fever lasts for more than 2 days, go to your doctor. We will clinically confirm that it looks like COVID. We'll do some tests to rule out other causes of fever like malaria, dengue, urine infection, and the corroborative evidence of low blood counts, low platelets, and high CRP. It's a clincher, Parul. I don't think we need to depend upon the RT PCRs here.
Okay. And Doc, there's been a lot of speculation on the CT value. So when your CT value is lesser, that means you are more contagious. And they've also the BMC shifted the CT value from 25 to 35 now.
Right.
So what is this?
So I think it's an excellent thing that you brought it up, and I'm very glad that I've been given a chance to talk about it. People day in and day out relate CT values of report as the severity of the disease. Oh, the CT value is 18 or 15 or 10, means the disease is very high. Should I be more worried than it would be if the CT value was 25 or 30 or 35 in cases now? CT value has nothing to do with the severity of the disease that you or your child are going to go through.
Okay.
It only determines how contagious you are to other people around you. If the CT value is low, 10, 11, 12, 13, 14, 15 means you are highly contagious to people around you.
Okay.
The value is 25, 35, 20, 30 means you are less contagious to people around you. But by no means will it predict whether you are going to go through 3 days of fever, 5 days of fever, whether you're going to get admitted, whether you're going to need an HRCT or oxygen. It does not predict the severity of the disease. It also doesn't tell you that if you have a high CT value, you should just isolate for 5 days. If you have a low CT value, you should isolate for 14 days. A COVID positive means you need to isolate for 14 days, period.
Okay.
CT value has nothing to do with it.
Okay.
So I'm glad you brought it up, but I want all the people, a simple request, don't become doctors, don't self-teach yourself to read reports, and for heaven's sake, don't help others in reading reports. Let them go to their doctors, you go to your doctors, your doctor will tell you exactly what is to be done.
Okay, thanks, doctor. Okay, what do we do with infants and toddlers if they've tested positive, and what medications to give a baby less than a year if they've tested positive?
So number one, isolation is the key. The minute the child is tested positive, children under 2 years, you can't make them wear masks, but isolation is the key. Put them in a room. Let one person take responsibility of that child, be with that child 24/7 for 10 days from the time the child has symptoms. The mother, mostly under 2 to 3 years, I think the kids are more manageable with the mom. To wear a good mask, N95 like I suggested, those days of cloth masks are gone. And take care of the child 24/7. Breastfeeding mothers can continue breastfeeding their positive child. If the mother is also infected with a small disease, not very severely coughing, can wear a mask and still continue to breastfeed. Children from 3 to 10 years can be taken care by another parent or the healthier parent or a parent at less risk, mother or father. Someone who's been through a COVID before, has small amount of antibodies, can take the charge of the child in a separate room for 10 days. At no point should anybody be above 55. Whether COVID's been there with them before or not, whether they have antibodies or no antibodies, no 55, 60-year-old should take care of a child who's tested positive. Okay. Now, when it comes to a child who's tested positive, medication-wise, we only treat the symptoms for the first 2 days, and there's nothing more than just fever medicines, paracetamols. Even there is no harm in giving ibuprofen if the fevers are very high. There is a myth that you cannot give ibuprofen. I don't think we've seen nothing, and there are no documentations.
Can you please specify on giving Combiflam and Ibugesic?
Ibugesic is Combiflam, ibuprofen is the drug. It's a combination of ibuprofen and paracetamol. There is no harm in giving. Please, because paracetamols may not bring the fever down the first or second day. The fevers are quite high. You've been through it yourself, Parul. You know the 102, 103s. And
Ibugesic, and I was like, are you sure? Can you please?
Yeah, so please, there is no harm. I'm sure your doctor will guide you with the dosage. When the fever crosses 2 days, it's time to go see your doctor. Forget the lockdowns. No one's going to stop you if you're taking your child to the pediatrician. Clinical examination is a must. Online consults become very difficult in sick kids. They don't open their mouth. They don't communicate that well. So go to the doctor. Clinical confirmation will happen. Symptomatic medicines are given. Like, for example, probiotics if loose motions, antispasmodics for cramps in the stomach, cough syrups, antacids for acidity and vomiting. They are given. If the child, has low counts, low platelets, high CRPs, we usually tend to add an antibiotic called azithromycin. Again, there is no documentation that this helps, but it is out of our experience. We know that the children tend to recover a little faster if they're given azithromycin. So many doctors prefer to start. Well, that's pretty much it. The only thing is if the child goes above 5 to 7 days of fever, shows high D dimers, shows involvement of cough and chest, little difficulty in breathing, we do tend to add inhaled steroids or oral steroids for faster recoveries. But that's pretty much it. No antivirals are given in children. They have not been authorized. They do more harm than help. No Fabiflus, no some people start blood thinners when the D-dimer goes high. Those are not recommended in children. In more severe cases, luckily we've not seen many, but your tocilizumabs and your remdesivir have not been indicated in children. And no ivermectin as well. So in kids, like I said when we started, Parul, it's very different than in adults. So please don't self-medicate. Please don't take extra efforts to talk to your friends and try and share prescriptions. okay, this was given to my child. Each child is a different case. Each child is a different severity, and they're completely different from adults. So please don't miss that, and kind of make it into a messy treatment protocol. You'll do more harm than help your child.
Okay. Should asymptomatic children be given medication?
No child without symptoms should be tested, and no child without symptoms should be given any medication by rule. If there is fear that your child has been exposed to someone who's COVID positive, who's currently not well, all you need to do is mask up, observe that child for 3 days. Everybody wear a mask, make the child wear the mask. The child is above 3 years of age. Watch for symptoms for 3 days. If the child shows no symptoms for 3 days, you're as good as the child never been exposed or had the disease. But don't test children without symptoms. Don't medicate children without symptoms.
Okay. What if one child tests positive and the other is negative or asymptomatic? Should we isolate them separately or together and keep them with the parents? Can parents sleep with the kids if the kids are positive and the parents are negative?
So all the positives and all the symptomatics should be together.
Okay.
If one parent is sick and the child gets fever, the sick parent can be with the child. A sicker parent is not going to make a mildly sick child more sick, because that's a fear people have. No, he's very sick and the child is just mildly sick. The parent will make the child worse or vice versa. That's not the fact. Let the sick people or the positive people be together. Okay. Yes, let the non-affected negative people be as separated from the positives as possible. So if you have 2 children, one is positive, one is negative, you have to separate them. Let one parent take the responsibility and stay with the one who's positive, and let the other parent stay with the one who's negative.
Okay. Do or can oxygen levels drop in children? Is an oximeter important to monitor kids' levels? Do market oximeters give accurate readings for children in specific?
99% of the oximeters, pulse oximeters, are made for the circumference and the thickness of an adult finger.
Okay.
Specialized oximeters are available for kids, but they're not that easily available. They're usually there in specialized institutes like pediatric institutes, like hospitals, like pediatric clinics. And the second thing is kids don't get that much of a lung involvement. So measuring and setting off a self-panic in the middle of the night with an improper reading of 82, 83 and driving yourself absolutely nuts is not the need of the hour. So lungs are not getting that affected. And no, unless until your pediatrician doesn't tell you to keep a watch on the saturation, do not start monitoring saturation in your children.
Okay. I did that and I got a wrong reading, and I remember calling you up immediately and you said, put that oximeter away.
Correct.
Okay. What basic medication should we start, and are there any specific meds we can keep at home and be prepared?
So keep your all symptomatic medicines, cough syrups, probiotics, antacids. Stock up. I wouldn't say stock up right now, it's very harsh, but fever basically it's all about fever management. I would rather say you spend more time and energy in keeping things that will keep your house sanitized. Have a treatment plan. There are houses in which luckily COVID has not entered, right? So let every parent of that house make a plan. Okay, what if my child gets COVID tomorrow? What will we do? We will take the responsibility. Which mask? Do we have enough N95s available? Do we put our cloth mask? Do we have a good thermometer, Parul? A good thermometer is the need of the hour. Measuring fever in children is not as easy as measuring fever in adults. Digital thermometers in the armpits are good in children about 3 and 4. Scan thermometers are pretty, forehead thermometers are pretty accurate in children. Use them. And don't just go by the reading. If your child is stone cold and you're getting a reading of 1 or 2, means there's something wrong.
Correct.
If you're getting a reading of 98 and your child is burning hot, there's something wrong. So use your common sense. See whether actually the reading is more accurate, inaccurate, take a call. And always I would say err in the side of taking the higher reading. If one is showing 101 and the other is showing 103, take it as 103 and treat it as 103.
Okay.
Good thermometers, good N95 mask, a good plan of action just in case any of the kids fall sick. Stock up, keep adequate amount of, I would say, paracetamols, ibuprofens and symptomatic medicines. That's good enough.
Okay.
Zinc, vitamin C, vitamin D can be given on a regular basis as to prevent the disease. It does not prevent the virus from entering the body, so will not prevent the disease, but definitely will reduce the severity of the disease, will make sure your child recovers with lesser sort of long-term effects and recovers much faster.
Okay, I was just getting to two supplements like vitamin C, zincovit, and D3 health. So I think
everything is good for prevention. A good calculated dose given in right amounts at the right schedules, followed by and prescribed by your pediatrician. You don't over medicate because there's something called hypervitaminosis B as well, which has more side effects than good. So good calculated dose. Vitamin C and zinc are also helpful in, do 2 months, stop again, do 2 months, stop again. Will require a long-term course once the child recovers from COVID to build up the immunity again to make him recover or her recover much faster.
Okay. So people say once you have COVID, you build antibodies.
Yes, you do. But antibodies are not dependent on whether you had the disease or not. They are dependent on how severe was your disease.
Okay.
You had few days of fever, loss of smell, loss of taste, a day or two of body ache. You just isolated for 5-7 days and you were in and out in no time. I doubt, sincere doubt that you will have enough antibodies to get you through 1 or 2 months of protection.
Okay.
The whole rigmarole of the disease. 10 days of body ache, 7 days of fever, probably a hospital admission, requirement of oxygen. Then you're okay to have antibodies, I can say safely for 3 to 6 months at least.
Okay. This is for adults and children, or does it vary between children and adults?
I think they're pretty much same. I think every child who goes through a proper disease of COVID does get antibodies that can protect them for 2 to 3 months.
Okay. So that means once you have antibodies during that time, you cannot...
No, not that you won't get the disease, but if you get the disease during that protection levels being significant, you will get a milder form and you will be in and out in no time.
So you can contract the virus.
See, there's nothing that can prevent the virus from entering you.
Correct.
Actually, I beg to differ. There's only one thing that can prevent the virus from entering you, and that is
the vaccine.
The mask.
Mask.
Please use masks. Please use masks. Before 2 weeks, before the shots, before 2 weeks of the second shot, the only thing that can save your life is the mask. After 2 weeks of the second shot, the only thing that will save you is the vaccine and the mask. But before that, it's only the mask that will save your life. So please mask up.
Okay. So a child can catch COVID again after he's recovered. Okay.
So within 2 months of recovery, a milder form, yes. But post 3 to 4 months, I think, let's not be too hopeful.
Okay. What are some of the post-COVID care tips that you would suggest to people, and especially in children?
So in children above 10, once they recover from COVID, we've seen something called a long COVID syndrome, where the children suffer from those mild side effects of COVID for a month or two after that. That includes very low energy, lot of headache, loss of appetite, severe lack of motivation to do physical exercise or follow academic schedules, cramps in the stomach, loose motions on and off. So these are they don't cause any further long-term permanent damage, but the child, yes, suffers for a few months after. We've seen 20 to 30% of children who have recovered above the age of 10 go through this long COVID syndrome. Less than 10 has been very rare.
Okay.
It's been rare.
And how does the long COVID syndrome go on till
a month or two post-recovery?
Okay. What can we do to boost immunity in kids? Are there any immunity boosting food that we can add to the diet in specific?
A well-rounded diet. Check all the boxes when it comes to all the types of foods. You want the right amount of carbs, proteins, minerals, vitamins, all in a balanced diet going in. And I want to re-emphasize the importance of sleep and immunity in children. Adequate sleep is the need of the hour. If you want your child to have the best genetic immunity possible that he or she can have, please make sure your child gets 8 to 9 hours of undisturbed sleep. That means cutting off all gadgets 2 hours before sleep time, because if your child is on a gadget 10 minutes before sleep, he may go to sleep or she may physically go to sleep, but the mind stays active for 2 to 3 hours, reducing drastically the amount of deep sleep and hence drastically compromising on the child's immunity.
Okay.
Good sleep, prescription prescribed by pediatrician about the amount of vitamin C, zinc and vitamin D.
Okay. Can fruits be given while your child has COVID? Because there's a lot of speculation saying you shouldn't give raw food or cold food or cold fruit.
Yeah. Parul, the basic concept here is COVID in children is a viral. So when common sense prevails, you avoid food that you would avoid in children when they're going through a viral.
Okay.
So anything that worsens the throat, that is anything that is excessively cold, colored or sweet to avoid. The virus does infect the tummy as well, so don't give too much of fried food, don't give too much of spicy food. Give liquid, give semi-solids which help the child urinate more and flush the virus out of the system more.
Okay.
So drink a regular viral. Keep what we call as a viral diet: khichdi soup, dal, bhat, juice, lembu pani, proteins.
Okay, so avoid fruits.
Fruits are not a problem. Citrus fruits are good.
Okay.
They need the vitamin C, but the juice of the citrus fruit should be room temperature, freshly squeezed, not too cold, no additional sugar to be added.
Okay.
So technically, out of our experience, the only two fruits that we feel cause the throat to worsen is strawberry and grapes. So these are two fruits I would avoid not to have during a viral.
Okay. And steam inhalation, is it beneficial for children? Should they do it?
So it's a little risky proposition here because people are obsessed with steam. Younger children who are too close to the steam source can cause burns, which are even worse than hot water burns. And out of precaution, if you kind of take the steam at a much farther distance away, there is no effect of it. So what we usually say is avoid steam in kids less than 5 years of age, because when you give them steam, they tend to fling around and harm themselves. Above 5, you can give steam by a close enough distance to make their face sweat, but not make it turn red.
Okay. And does steam cause a little clogging? Because some different steam machines are different nowadays. A lot of people are using the facial steamers versus the other ones which give a lot of water. So when they're breathing, they cause a lot of chest congestion, it kind of clogs up.
I think steam, steam coming out of hot water is the thing. I think it depends on what you add on it. Some people add, medications in it with the steam that helps to break the mucus. So if you feel too clogged up in the chest and the nose, you can always add those medicines, which what we call are mucolytics. They break the cough to watery discharges so they can leave the system.
Okay, so eucalyptus oil or ajwain or vicks or something is...
Excellent natural mucolytics. Yes, I would encourage it.
Okay.
But there are something called, eucalyptus oil-induced epilepsy we've seen recently now.
Okay.
Where the eucalyptus oil amount is so toxic that the child actually gets a seizure. So please don't overdo things.
Okay. So ajwain would carry it.
So everything in limitation.
Okay. So another thing is a lot of people, what they say that I'm in my bubble and they're trying to maintain a social bubble. My family is only going to meet that family.
The days of social bubbles are far gone beyond. There is no opportunity, no point having a social bubble now. Keep to your homes, keep your bubble as small as possible, restrict it to only family members. Yeah, mates is also a risky proposition now. So if your mate's coming in and going out, in and out every day is very risky. Hopefully full-time servants, I know it's difficult, but if you can, stick to that. Bubbles are your little family and stick to it for the next few weeks. Don't make friends. Don't go out, don't go down, avoid socializing is my request. Because COVID has entered every home. COVID is there everywhere. So trying to even step out and have that closed bubble is pointless.
Okay. We've heard about the flu shot and pneumonia shots. How important is it to take them?
So take it if it's time to take them. Your pediatrician will tell you there are certain fixed schedules that the pneumonia shots and flu shots need to be taken. But as and when to make a special effort just because it's COVID time, it has no connection with COVID in kids.
Okay. Does it help in any way in...
So flu shots and pneumonia shots have known to help in adults because in adults the COVID is causing more harm, more chest involvement, more ground glass densities, more pneumonias. In kids, we've not seen that much. involvement of the chest. So taking that extra leap of faith and saying that, if I take these 2 shots, it's going to help more. No. But if it's due, it's pending, it's as per your recommended schedule, don't delay.
Okay. At what age do the flu and pneumonia shots start?
They start, in fact, if you're following the proper schedule, you're done with all your pneumonia shots by 2 years of age.
Okay.
2 shots are recommended on yearly basis, up to 5 to 6 years or even up to 10 years of age.
Okay.
Depending on how frequently your child coughs and has had bronchitis or not. But it's a yearly shot, up to 5 to 7, 8 years of age. But pneumonias are not just a random, the Prevenar or the pneumococcal shot is not a random shot you feel like taking as and when. It is a part of the routine schedule that your pediatrician has given your child. So he is pretty much covered.
So would you recommend this for adults?
Yes. Currently, it does, because what happens is when the virus enters your lung, causes pneumonias, your immunity of your lungs is very low. So then at that time, for those bacteria and those flu viruses to make create more havoc and make things worse is very high. So I would request adults, if they've not taken a pneumococcal shot or a flu shot in a while, there's no harm in taking it.
Okay. COVID and grandchildren, your opinion?
Yeah. So if your grandchild has a possibility, forget, I would not even go to that extent to say about COVID, but if your grandchild has fever today, I know you love your grandchildren, but as grandparents, please mask up and stay away from that grandchild for the next 10 days. It's as simple as that. Grandparents tend to suffer a lot. Grandparents, bear the biggest brunt of the disease. I think their grandchildren may mean the world to them, but it's just a matter of few days. Please control yourself, stay away. If you're there and you're alive and you're happy, you can spend years with your grandchildren. I don't know if you are going to the hospital.
Do you have anything extra that you want to add on?
I want to add on and take this opportunity for every person above the age of 18 to take the shot when it's supposed to be taken. Don't dally. Don't be choosy about Covaxin, Covishield. Take what you get. There are no side effects that's going to hamper you. Yes, you're going to be low for a few days. You're going to feel the brunt, but that's good because that means the vaccine's working. That means the body is developing immunity and preparing for the disease, just in case you catch it. So don't dilly-dally. Don't talk to anybody besides your doctor when it comes to any queries regarding the vaccine. But please, for heaven's sake, take the vaccine. It's the only way we can throw this disease out of our country and get back to our normal lives.
Thank you so much, Doctor. I think you've answered a lot of questions that everyone's been thinking about. So I'll see you soon.
Stay safe, guys.